Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. This is 5 NCLEX questions. Without delay, let's get started.
The nurse should assess the client for digoxin toxicity if serum levels indicate that the client has a 1. Low sodium level, 2. High glucose level, 3. High calcium level, 4. Low potassium level. The correct answer is 4. A low serum potassium level predisposes the client to digoxin toxicity. Because potassium inhibits cardiac excitability, a low serum potassium level would mean that the client will be prone to increased cardiac excitability. Which of the following foods should the nurse teach a client with heart failure to limit when following a 2-gram sodium diet? 1. Apples, 2. Tomato juice, 3. Whole wheat bread, 4. Beef tenderloin. The correct answer is 2. Canned foods and juices, such as tomato juice, are typically high in sodium and should be avoided in a sodium-restricted diet. A client receiving a loop diuretic should be encouraged to eat which of the following foods? Select all that apply. 1. Angel food cake, 2. Banana, 3. Dried fruit, 4. Orange juice, 5. Peppers. The correct answers are 2, 3, and 4. Hypokalemia is a side effect of loop diuretics. Bananas, dried fruit, and oranges are examples of food high in potassium. When assessing an older adult, the nurse finds the apical impulse below the 5th intercostal space. The nurse should further assess the client for 1. Left atrial enlargement, 2. Left ventricular enlargement, 3. Right atrial enlargement, 4. Right ventricular enlargement. The correct answer is 2. A normal apical impulse is found over the apex of the heart and is typically located and auscultated in the left 5th intercostal space in the midclavicular line. An apical impulse located or auscultated below the 5th intercostal space or lateral to the midclavicular line may indicate left ventricular enlargement. A client experiences initial indications of excitation after having an IV infusion of lidocaine hydrochloride started. The nurse should further assess the client when the client reports having 1. Palpitations, 2. Tinnitus, 3. Urinary frequency, 4. Lethargy. The correct answer is 2. Common adverse effects of lidocaine hydrochloride include dizziness, tinnitus, blurred vision, tremors, numbness and tingling of extremities, excessive perspiration, hypotension, seizures, and finally coma.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.